this video, I'm going to show you how to safely breastfeed while drinking. From the best practices for avoiding alcohol transfer in your milk, to tips on the timing and frequency of nursing sessions, I'll cover it all. 1. What are the best practices for avoiding alcohol transfer in breast milk? It is important to remember that alcohol can transfer from the mother's system to her breast milk. To reduce this risk, mothers should wait until the effects of alcohol have worn off before breastfeeding their baby. Alcohol levels in a mother's blood typically peak 30 to 90 minutes after drinking, and then steadily decrease over several hours. So if possible, wait at least 2 hours per drink before nursing your infant. In addition, it is also recommended to pump and dump your breast milk if you have had more than one alcoholic beverage, or if you feel any buzzed feeling or impaired judgment as a result of drinking. Pumping prevents built-up alcohol from accumulating in your breast milk and endangering your baby. Even when pumping and dumping, it is best to wait at least 2 hours before breastfeeding again. 2. How can I determine if I'm drinking too much while breastfeeding? It is important to keep track of how much alcohol you are consuming when breastfeeding. The amount of alcohol consumed can affect the amount of alcohol that gets into your breast milk and is passed on to your baby. It's best to limit drinking, as it's difficult to predict exactly how much alcohol will get transferred into your breast milk. The American Academy of Pediatrics (AAP) recommends avoiding any and all alcoholic beverages while breastfeeding, since there is no safe amount that has been established. If you choose to drink while breastfeeding, consider these tips. Drink only after nursing or pumping, and wait at least 2 hours before nursing again. Consume no more than 1 to 2 drinks per day. Store express breast milk separately from the alcohol. Feed your baby with formula if possible in between nursing sessions. Make sure you are well hydrated with water and other fluids to reduce concentration of alcohol in your milk. If you're concerned about how much alcohol you've consumed, talk to your healthcare provider for advice. They can help assess the risks associated with breastfeeding and drinking, and provide additional guidance on ways to minimize any potential harm to your baby. It is important to remember that any amount of alcohol can enter the bloodstream of a nursing infant and increase their risk for developmental or health problems later in life. 3. Are there any foods or drinks that shouldn't be consumed while breastfeeding? Yes, there are certain foods and drinks that should be avoided while breastfeeding. These include alcohol, fish with high levels of mercury, caffeine, or other stimulants, large amounts of vitamin A, certain herbs such as parsley or peppermint, and some immune-suppressing drugs. It is also important to avoid street drugs during breastfeeding, as they can pass through breast milk and cause harm to your baby. It is best to speak with your healthcare provider if you have any questions about which substances are safe while breastfeeding. 4. Is it safe to use a pump after having a drink? Yes, it is safe to use a pump after having a drink. However, you should wait at least 2 hours after your last drink before expressing or pumping milk. During that time, any alcohol in your bloodstream should have cleared enough for you to safely express some milk for storage and later feeding. The amount of alcohol present in the expressed milk will be significantly lower than if the same amount were consumed directly. If you plan on consuming alcohol while nursing or pumping, it is recommended that you plan ahead by collecting an extra supply of breast milk prior to drinking so that it can be used instead of freshly expressed milk until the alcohol has cleared from your system. Additionally, avoid drinking during periods when breastfeeding is more frequently, such as nighttime feedings. It is important to remember that the effects of alcohol can linger in expressed milk for 2 or more hours after drinking, so be sure to wait long enough before pumping or expressing milk. 5. When should nursing sessions occur when drinking alcohol? It is recommended that nursing sessions should occur no closer than 2 to 3 hours after an alcoholic beverage has been consumed. This is to ensure that the alcohol levels have decreased in the breast milk. Mothers can be expressing milk and store it for later use if they plan on drinking throughout the night and wish to continue breastfeeding close to their normal schedule. 6. Does consuming alcohol impact how much milk is produced by the mother's body? Yes, consuming alcohol can affect the amount of milk that a mother produces. Because drinking alcohol may reduce the production of the hormone prolactin, which is responsible for stimulating the production and release of breast milk, moms who drink can have reduced amounts of available milk. It is important to note that this effect may only be temporary, and that it should not prevent mothers from breastfeeding their babies if they choose to do so. Additionally, pumping after consuming alcohol may help stimulate more frequent letdowns and increase production. 7. How long does it take for alcoholic beverages to leave an individual's system before breastfeeding again safely? The amount of time it takes for an alcoholic beverage to leave a person's system depends on a variety of factors, such as the type and amount of alcohol consumed and body composition. Generally, it takes about 2 hours for one drink 12 ounces of beer, 5 ounces of wine, or 1.5 ounces of 80 proof spirits to be metabolized by the body and leave your system. However, if you have consumed more than one drink in an hour or have a higher body weight, it can take substantially longer for the alcohol to leave your system completely. Thank you for joining us today to learn how to safely breastfeed while drinking. We hope this video has given you the information and confidence needed to make informed decisions about breastfeeding when alcohol is involved. If you have any further questions or need more advice, please don't hesitate to contact your doctor or a lactation consultant for additional help. Be sure to leave us a comment with your thoughts on this topic and subscribe if you enjoyed our content. Thanks again for watching and stay safe out there.